even if you're starting with 5, 6, 7, 8, 9 people, so often there's this instinct of like, oh, go collaborate, go organize yourselves. Nobody has time for that. But if there's just one person whose actual full-time role is to just like the really boring stuff, make sure that the agenda goes out every week at the same time. Make sure there is a call scheduled. Make sure that there's a couple one-on-one conversations that happen before that big group call, so we actually come in there ready to make decisions and align and not, spin around in circles. Whatever. Just that very small amount of, let's call it shepherding, is the difference between just a flock of sheep running wild and a flock of sheep that's actually going somewhere, accomplishing something, and making moves.
Welcome to System Catalyst, the show that cracks the code for making the world a better place. I'm your host, English Saul. Today, I am joined by my dear friend and collaborator, Dr. Madeline Ballard. She is the CEO of Community Health Impact Coalition, known as CHIC, an organization I've been proud to support since its beginning. At CHIC, Madeleine leads global systems change, creating international guidelines for community health workers, mobilizing funding, and shaping policy in more than 60 countries. Madeleine earned her PhD from the University of Oxford as a Rhodes Scholar, and she is now on the faculty at the Icahn School of Medicine at Mount Sinai. Her leadership has been recognized with some of the most prestigious honors in the field, including the Skoll Award for Social Innovation, the Rue Prize, and the Schwab Social Innovator of the Year. Madeleine, welcome. It's great to have you here. I'm so excited.
Me too. Thank you so much, English. I'm a longtime fan of this podcast, so it's awesome to be on here with you. So thank you.
Awesome. Well, I have to say, I've been looking forward to this conversation for such a long time. We have been, I think, just in the world together, existing together since the inception, really, of CHIC. And I obviously am the biggest fan of you and have been able to watch you not only grow this organization, but grow as a leader and make massive impact on community health at work and community health workers all over the world. But before we get into the depths of this conversation, which I know we're going to get there very quickly, I recently read that you have lived in 5 or 6 different countries. And I didn't know this about you. And we've, been friends now for so long, but you've lived in a lot of places. And I would love to know, first of all, what's your favorite? And second of all, is there anywhere that you still want to live that you haven't lived yet?
Ooh, that's a great question. So I was born in Canada. I got to say that's my fave, got to go with the hometown. And ended up moving to the States for university. Worked and lived in Mali, in Liberia. I was in Germany for a bit. As you said, got my PhD in the UK. So, I've been kind of traipsing the globe. I don't know. I feel maybe a desire to be rooted now. So excited to visit new places, but at the same time, really, really pleased to just be here in London and have a really nice community around us, both locally and globally.
Amazing. Madeleine, this podcast really aims to sort of highlight the stories of systems change, of systems entrepreneurs, of the different kind of, I think, just experiences that you have. And I would love to hear a little bit about the story of what got you interested in community health and community health workers from the beginning.
Yeah, well, so it actually goes back to this sort of peripatetic existence between countries, because I grew up in Canada, where healthcare is, famously a right. And then suddenly, at 18, 19 years old, I was in a country right next door, which I had always heard was, much richer, much more powerful, much more important than the place that I was from. And yet when I was there were still waiting lists for HIV drugs. And I'm not that old, this was in the 2000s. And it was just such a moment of moral clarity, like this idea that there are people out there who are surviving these illnesses that are easily treatable, and then there are those who are dying from them, not just kind of around the world in these far off corners, but right next door in the city I was living. And I think that's where it became clear that so many of our problems stem not just from a lack of innovation, but a lack of access. Who could get care, who couldn't get care. And so anyway, I ended up getting involved in HIV activism when I was there. And that connected me to this amazing transnational network of solidarity, connected with folks in South Africa, in Liberia, communities in Boston, and ended up joining the team in Liberia after I graduated, and worked with community health workers who were doing kind of the same stuff that we were trying to do in Boston, which was make HIV care available to those who needed it. And again, really clear, if you have HIV, you have these medications, you live a long and happy life. And if you don't, you are dying, you are actively dying. And so, as I said, I've since kind of, lived and worked with CHWs in the States and Liberia and Mali, Germany. And I think it's kind of the same everywhere. Community health workers are, in all of those places, the invisible backbone of the health system. Their work is both ordinary in that it's every day, and also extraordinary in that they're reaching the folks that so often the health system struggles to reach. And I knew I kind of just wanted to continue to work together to make community health work visible and valued, so that they could increase the amazing impact they're already having.
I mean, I definitely, I think you and I feel really similar about community health workers and the important role that they play, and also the important role that CHIC plays. So maybe just for our audience, can you just give us kind of the, what is CHIC? What does CHIC do? And why, how does it relate to community health?
Yeah, so CHIC was founded to address a pretty glaring gap. So let's back up a second. Community health workers, for the uninitiated, are trusted members of the community who are bringing primary health care kind of straight to their neighbor's doorstep. So unlike many other health professionals with whom many folks are familiar with, who are often working maybe at hospitals or clinics, CHWs are meeting people right where they are, sometimes, literally walking miles to visit families in their homes, whether that's sort of a remote Liberian rainforest or a small community in rural Alaska. And one thing that community health workers have in common around the world, unfortunately, is that millions of community health workers are actually not paid, supported, supplied. And 70% of community health workers are women. And so we see this sort of triple-sided human rights issue. We have a labor crisis, we have a gender crisis, and where CHWs are basically both being exploited and less effective for patients. Because you can't treat someone if you don't have the medicine, or you haven't had the ability to refresh your skill set, or if, fundamentally you're just no longer in post because you've had to go find another gig because you can't make ends meet while providing care in your community. And so Community Health Impact Coalition is making professional community health workers, so think salaried, skilled, supervised, supplied, the norm. And we're doing that by changing guidelines, funding, and policy. So together, we bring together CHWs and health advocates from around the world to do three things. We research to equip international norm setters with evidence. We advocate together to kind of influence global financing institutions, and then we activate in-country networks of community health workers to ultimately win that national policy that sets them up to provide great care. And the result is basically professional community health workers and ultimately quality of care for everyone, including the ones who are providing it. I mean, community health workers, for anyone who's not familiar, do a incredibly diverse number of things. So providing their services, everything from birth control injections to asthma care management. And there's, just as someone who has a PhD in this, heaps of really rigorous trials that show that community health workers can ultimately reduce both the level of sickness in a population and the number of deaths, and create kind of a 10-to-1 return on investment, which basically means that for every $1 that you're investing in community health worker programs, you can yield a return of up to $10 through saving lives, creating jobs. And I think a really common misconception is that this is about, like malaria in the Liberian rainforest. And I think that is a dangerous one because it's not. What's really important to know about community health workers is that they're often the first line of defense against emerging health threats. So if you think about, things like Ebola or COVID, so often, the first symptom is something like a fever or something that you would go to a community health worker to recognize. And basically, when we are leaving community health workers unsalaried, unskilled, unsupplied, we're not just, we're basically endangering children in every country because we have this kind of global early warning sign for pandemics that we're effectively leaving unplugged. So I think maybe you've never heard of community health workers, but ultimately, if they're left out in the cold, it's your health that's at risk. So this is, something that really affects all of us, whether or not we might be aware of it.
Madeleine, thank you for helping us understand a little bit about what CHIC does. I would love, can we go back a little bit further? I mean, I was lucky enough to be kind of part of the initiation and beginnings of what is now CHIC. And I remember being in the conversation with the, handful of other amazing folks, Raj and Ari and Jenny, when we were discussing who should run this organization. And your name came up. And immediately across the board, everyone was like, absolutely. Like there was no convincing. It was just like 100% Madeleine is the one. And I want to know a little bit about what was going through your mind when you got that call. I think it was probably Raj that talked to you.
Yeah, so
right?
This is Raj Punjabi. He and I worked together in Liberia on HIV access, primary healthcare access. Lived in Liberia for a couple of years with CHWs, and doing this work of professionalization, of making sure that CHWs are equipped to provide great care. And eventually, I left Liberia, did my PhD. And when I was finishing my PhD, I got this call from Raj, and he was like, "Hey, I want you to come help us do this thing." And I was like, "Awesome. Like, what's the thing?" He's like, "Well, we don't really know." I was like, "Okay." Who's the us? And he's like, "Oh yeah, just like all the NGOs that we compete with for funding." And I was like, "Super, sounds like an absolute poison chalice. Where do I sign?" So I think, fundamentally, what is it? You probably have the stat on this, 70-80% of collective action, field catalyst systems change efforts fail. And you can see kind of why just in that short vignette. It's like the cards are stacked against you. There's so many disincentives to collaboration, to arriving at clarity, to sticking with it. And that's exactly what we were facing at the beginning of what became Community Health Impact Coalition.
That's awesome. I want to talk a little bit. I want to kind of take a higher view now around, one of my sort of favorite things that I got to witness that CHIC did in the beginning was really this sort of the WHO guideline work for community health workers. And I wonder if you could talk to us about that project, that process a little bit and what it took, because I think it's an amazing lesson, not only in galvanizing a system, but also collaboration, because it took, the members of CHIC are all these different organizations who are service providers in the community health space that came together to do something that was bigger than just the one entity. So could you tell us a little bit about that process and kind of the systems lens that you all went through?
Yeah, sure. So I think when people, I love your podcast because it demystifies systems change, which I think is just a concept that a lot of us trip over, right? Because when we're thinking about how can we heal the world and how can we help people, we so often think about just meeting the needs of the person in front of us, right? Doing that service provision, which is so critical. Those acts of solidarity are, again, what weaves the social fabric. And I think it's also important to ask the bigger questions of, wait a second, why does that person need help in the first place, And is there kind of an upstream thing that we could be tackling such that many fewer people might be in need in the first place. And so, at Community Health Impact Coalition, that's how we approach this issue of community health. We really think about transforming the conditions that hold the problem in place. And for us, a central actor in all of this is the Minister of Health, Minister of Finance in any given country, right? They're the ones who are basically in charge of the policies that govern how the health system works and how health workers within it are treated. And to our earlier part of the conversation, we were kind of saying, but wait a second, it was all with evidence. And it's so clear that community health workers just come in and like save the day every time there's a pandemic. Like, why do we have still so much informality and so many folks who don't have the support they need to provide great care? And to us, it didn't, like, the answer was clearly not, oh, because the Minister of Health of Madagascar woke up this morning with malice in his heart. Like, no, they want to see a healthy population. So, what's holding them back from making these really powerful investments? And I think we basically identified kind of three things. One was, at the time that the coalition was founded, officially founded 5 years ago, but we came together kind of informally about 7 years ago, and we'll talk about actually why that's important maybe a bit later. But there was no guideline on how to deliver community health, which is, again, astonishing. Community workers around 100 years, and yet World Health Organization, nothing about what does the evidence say in terms of how to deliver this care. So that was kind of obstacle one, or condition one. The second was obviously financing, right? So not just there's a return on investment, but like all good return on investments, you need that startup capital to get things moving. So, how can we engineer that? And then finally, as we were discussing earlier, like this lack of community health worker voice. Where is the demand for this domestically, right? Because health is not just, again, technical, it's also political. Ministers of health are fundamentally politicians. So who's in their ear from this constituency saying, hey, it's a little lean here and we could do a lot more if we just had some of this basic value chain of support in place. We could do a lot more for patients. So anyway, first thing we worked on together was this guideline piece, and the collection of the ragtag bunch that started the coalition was actually a very special group of organizations, and I'll name them now. There was Partners in Health, Living Goods, Last Mile Health, Muso, Possible, and Integrate Health, and they were special in that these are the organizations that had actually published a lot of the research that showed the dramatic declines in under 5 deaths, or the dramatic declines in sickness in a population when professional community health workers were in an area. And so that was actually what we, after that phone call with Raj, that was one of the first things we identified. We were trying to think about, well, what's the value proposition of this group? It's that it's getting the results on a small scale that we want systems to get on a large scale. And the best news is that it's not the recipe for Coke that they're using. It's not anything that's very complex or secretive. They're just doing very basic health workforce management well. They're just making sure that people are paid. They're making sure people are in stock, that they have ongoing training. And that's awesome news, because health systems are already doing that. They're already doing that for doctors and nurses. We just need to, adapt those systems so that they work outside the clinic wall. And that's not actually rocket science. So, anyways, we brought together that group and started campaigning for this guideline. And one of the biggest assets, I think, of any coalition is the ability to create surround sound, which is to say, you ever feel like the universe is talking to you, right? You like read something in a newspaper, then a friend mentions it, then you see it online. And nowadays we think, oh, it's because our phones are listening, which they probably are. But it's the same in advocacy. A lot of the time, a guideline maker or a Minister of Health will have that same experience. And P.S., the big secret is it's not an accident either. And it's not their phone listening. It's just advocates listening. And so we actually ended up getting 5 or 6 different people, all these different organizations from different parts of the world on this guideline review committee. And this is important because obviously, WHO runs a transparent, equitable process. They ensure, diversity, again, across geography, across sex, across a number of relevant characteristics. But because we had a diverse coalition, when every single person applied, turns out a lot of us got onto this review committee. And again, they also follow a very rigorous process when it comes to making guidelines. Like, it's not just some people in the room chatting. They do these huge systematic reviews, which means they basically systematically go through every single possible paper about this topic, pull the evidence together, and share what it says. However, as with anything, there's still interpretive room there when it comes to the final recommendation. What do we recommend based on the evidence? And so, for example, one of the things that the guideline found was, there's actually not a ton of studies showing that, community health workers perform better or worse, whether they're paid or not. So we're just not going to recommend anything. And it was because of the composition of this guideline group that we were able to say, wait a second, we were down the street from the International Labor Organization. Like, are there studies for whether a plumber performs better or worse? I don't think so. This is a weird question to be asking. I think we should just say that, people should be paid for their work. And they were like, okay, let's recommend that. And so we were able to get a lot of stuff in around salaries, supplies, ongoing career pathway, skill set into that guideline because you would say something English and then I would back you up and then another voice and then another voice. And they don't know that we're all part of the same WhatsApp group. But because we had our ducks in a row, we were aligned, we had the evidence, we were taking this very seriously, and we came into that room, we were able to kind of own the room and ultimately get a guideline that had kind of 7 of the 8 practices that we were advocating for embedded in it. And again, that guideline now influences policy in 190 countries. Yeah. So what started as this, again, very outlandish idea is now just the global standard. And that really proves that I think this type of change is possible. And that evidence, again, is now behind guidance that the WHO put out during COVID. It's behind other normative agencies that are in conversation with WHO, like Africa CDC. And so, it's really taken on a life of its own at this point.
It really is just such an amazing, powerful story that speaks to, I think, what happens for systems change to work is it requires catalytic people, catalytic organizations to put aside their ego and say, we're going to come together to do something for the greater good, for the population that we are built to serve. I want to go back to kind of this amazing story of this work that you all did. Talk to me about the funding part of it. And I know from my perspective as a funder and with a group of funders, it was really important for us to also fund this collaboration, right? Put funding egos aside to fund this work. But I want to hear from you about just kind of what that actually looked like and what that felt like. And was it, and is it still hard to get funding for this kind of work that isn't always super impact metric based? And what does that look like?
It requires having both clarity and humility that there are several seemingly disparate, but ultimately interconnected paths to justice. What does that mean? It means that some mornings you might find, generosity quietly stirring a pot of soup in a local church basement. Other days it looks like, a data scientist, like a Dr. English Sal, perhaps, meticulously calculating how to save the most lives with every donated dollars. And then still others, it's targeting the systemic injustices that make the soup kitchens a necessity in the first place. And I think it's important to articulate what type of work you are doing. Is it rooted in solidarity and local care? Is it betting on, effective altruism's data-driven efficiency? Or is it aiming for this more structural reform? And I think the temptation is to claim moral or intellectual superiority of one approach and maybe dismiss the others. And I think that that's incorrect, right? None of these exist in isolation. In fact, they depend on one another, right? But I think being able to articulate to somebody who wants to provide direct service why they might want to complement a systems investment as well, or for someone who's maybe doing effective altruism, why if they broadened the lens through which they were looking, they might see efficiencies that they hadn't previously captured in their math. But ultimately, just meeting all of those pathways with a lot of respect and energy helps people find themselves in the story, and then helps you find the folks that want to write the story that you're trying to author together, if that makes sense.
I think it does. I think that I remember, God, it feels like it was so long ago now, but there was a meeting that we were in, and it was me and you and a few of the members, like actually a good portion of the members of CHIC at that time. And we couldn't find a meeting spot. And so we were all sitting on the floor in a room somewhere. And we were all just like talking about, this was just in the early days. And one of the things you said always stuck out to me. And it was the reason that we are going to continue to make ourselves valuable as CHIC is because we're just going to do the work. We're just going to do the legwork. We're just going to do the work of writing the things and collaborating. And regardless of the attribution of where that sits, we just have to keep putting one foot in front of the other and doing the work. And I'd love for you to speak to just, I think, some of our audience who either have found themselves in a position like you're in, and like you were in the early days of CHIC, where you were trying to build something out of what probably felt like thin air for a while. What would you want to tell them? What would you want to tell those people where it's like it feels like they're grasping at clouds?
Yeah, that's a great question. I think I'll say two things. One, to funders, like, if you're not sitting on the floor, what are you doing? So I think I'll just say, like, appreciate that. I think it's so clear that so many of our problems are so big, and we need change commensurate with the size of those problems, right? And so collective action is needed. Structural change is needed. And yet, despite the potential for this model, again, as you mentioned earlier, like most field catalysts do fail. And why is that? And I think there's actually been heaps of research on this, luckily, which we also consulted when we were kind of trying to put this together. And I think I'll just share one insight, one thing that you did that I would love for funders to take away from this conversation, which is support the pre-work. One of the research findings about successful field catalysts is that the ones with the longest tail of kind of informal collaboration, and it was an average of about 18 months prior to launch, ultimately were the most successful. I think so often these big, like, world-bending ideas get announced from a stage before any T has been crossed, any I has been dotted. And that's a disaster, because then boom, like, you're on the clock. What have you done for me lately? And it's like, not a lot, because we have to figure out who's actually in, how we're working together, what's the value proposition. All of that is very messy. It takes place on the floor, and it's better that it takes place in secret, or at least, not on a stage. Yeah. And again, it's all it takes is just a very small amount of FTE. And same thing, like, even if you're starting with 5, 6, 7, 8, 9 people, so often there's this instinct of like, oh, go collaborate, go organize yourselves. Nobody has time for that. But if there's just one person whose actual full-time role is to just, like, the really boring stuff, make sure that the agenda goes out every week at the same time. Make sure there is an agenda. Make sure there is a call scheduled. Make sure that there's a couple one-on-one conversations that happen before that big group call, so we actually come in there ready to make decisions and align and not, spin around in circles. Make sure that we're then generating momentum. Make sure the thing gets published, whatever. Just that very small amount of, let's call it shepherding, is the difference between just a flock of sheep running wild and a flock of sheep that's actually going somewhere, accomplishing something, and making moves. And so I think that was really cool. And that's a takeaway for funders. For people who are in the work, I would say, try to find an English child, try to find someone who's able to kind of give you just that eensy, tiny bit of breathing room. Because I think it's also important, we're talking about funding for field catalysts. Another research finding is that higher performing kind of multi-stakeholder initiatives tend to have more donors at launch compared to their lower performing counterparts. So again, this is why it's also important not to like rush to the stage. It's important to do the work. Maybe like English, she put in a little injection to help us figure something out. Then we were able to get some traction and then crowd others in. And then we announced. And then that support, again, from multiple people really dispels the perception that this initiative is merely kind of an extension of a single donor's program or agenda. And it gives the impression of critical mass and momentum, which then attracts more people. So I think that's another fun tidbit from the research. But for folks who are on the other side of the table or also on the floor doing the work as part of these initiatives, or who are trying to start these initiatives, the number one piece of advice that I always give, and that I really need to credit Phyllis Height and other longtime collaborators of ours, not for the tag phrase, but really for the concept, which is be a team, not a club. By which I mean clubs have a shared interest. Like we're all sitting around chatting about community health workers. We all like community health workers. We are community health workers. Teams have a shared mission, right? We're here to make crushing CHWs the norm. And when we extend the team metaphor, we get insights like Phyllis's. This is the advice she gave me when we were just starting these calls after Raj had somehow convinced me to sign something. And it was, how you're talking to everybody one-on-one. And I was like, well, no, because we talk, in a group. And she's like, ding dong, yeah. Call them up one-on-one, and it's because change is relational, fundamentally. And I think that's a lesson from the soup basement as well. And I think in so many coalitions or teams, there's this, most members, they only know the secretariat. They only know the person who's hired to be there. They don't know each other. They kind of, it's the difference between a golf club and a team. Yes. It's like, no, teams know each other. They are dense networks. They are not a hub and spoke. True and lasting momentum springs from these deeper connections. And so you have to really put in the energy to cultivate that. And that needs to be intentional. And it could be these quarterly one-on-ones. It could be, as we do still to this day, kicking off every large group meeting with random, in-person or Zoom 5 to 7 minute one-to-one breakout rooms, having new joiners connect with a buddy, sending people a birthday card, like all of this stuff. It seems like quote unquote non-essential fluff. And yet when people feel like their unique contributions to a group are noted, that they're not interchangeable, it's important that they specifically are there. That's when you're really starting to cook.
It's so true. And I can't remember which of our dear friends said this. It was either, Rob with asthma management. It might've been Phyllis. It might've been Dave, but I think they said something I think we were both in the room, but they would say progress goes at the pace of trust.
100%.
And I think that is so true. And I think that the CHIC journey has illustrated that from the early days of us getting on calls, trying to grasp at what this was without really having a structure to it, all the way to, just this past April, you standing on the stage at School World Forum, receiving the award for incredible systems change that CHIC had made. And, I think it requires a lot of patience and a lot of grit and a lot of trust. And I want to ask one final question, for our time today, Madeleine, and that is, what is a question that you want to leave our listeners thinking about when they are on their drive home from work tonight? What do you want the question to be that pops into their mind?
Maybe a double-barreled question. What are you fighting for? And are you wasting enough time while you're doing it? And let me share what I mean by that. I think, first of all, the truth is that, to extend the club and team metaphor, clubs, hobby, right? Teams, they know the score, right? It's a mission. We are trying to get something done together. And I think so often emerging coalitions, groups, collectives are at risk, right? Because everybody comes to the table, they want to project their own desires onto the group. And if you let that go on too long, where everyone kind of thinks that we're doing something, but everyone thinks something different, if you don't settle on that clear mission and those tactics early, if you just remain a blank slate for everyone's desires, that everything to everyone approach is going to lead to underachievement and eventually to dissolution. And so I think that clarity is really important. And that means going from, hey, we want to see CHWs be supported, to that means they're in national policy, to that means we have a map showing where they're recognized in national policy and where they're not, and it's color coded, to that means we're releasing, and this is coming down the pipe this year, a 2.0 version of that map where we see not only where they're in the policy and where they're not, but where those policies are being implemented well, and where they're not being implemented with fidelity. And that clarity is so energizing to people. So I think that question, how are you striving with clarity, but doing so in a way that is actually sustainable, in that it brings folks along, in that you're wasting lots of time on the floor giggling along the way. That's the only way that you're going to get to the end of that road. So, yeah.
That might be one of my favorite things that I've ever heard on this podcast. So thank you for that, Madeleine. That was awesome. You might have just named this episode with that last nugget of wisdom. Madeleine, thank you so much. This has been phenomenal. And I'm so glad that we finally got you on this podcast, and you're doing some amazing stuff. CHIC is amazing. And all of the people and the groups that we named in this conversation are going to be in the show notes here, so that everybody can kind of go and explore. And we had some of those folks, Raj being one of them, on previous episodes that we'll link to as well. So just thank you so much.
No, thank you, English, for just continuing to be in this fight. This was a delight.